A powerful earthquake struck Myanmar on Friday. The earthquake is the deadliest natural disaster to hit Myanmar in years, with more than 2,000 deaths. It has damaged critical infrastructure across the country of 55 million people. Rescue workers, sniffer dogs, paramedics, and millions of dollars in aid have begun arriving in Myanmar. A rescue team from China was among the first to respond. The Yunnan Rescue Medical Team arrived there 18 hours after the earthquake. The team successfully rescued a trapped victim in cooperation with local rescue forces. As of Monday, Chinese rescue teams have saved several survivors, including a pregnant woman. Russia sent 2 aircraft carrying rescue workers, dogs, ambulances, and rescue vehicles. India sent a search and rescue team, medical professionals, and a military transport aircraft filled with blankets, hygiene kits, and food packets. Vietnam, South Korea, Japan, and other countries are also providing aid to Myanmar. But the rescue efforts have not come easy.
While waiting for the bulldozer to arrive, we began working using only our hands. If we're unable to make progress manually, we use machinery like bulldozers, as many of the collapsed buildings are pressed into the ground. We're also facing communication difficulties due to unstable mobile networks, which makes coordination challenging. The difficulties we face are the ongoing aftershocks. Minor earthquakes still occur from time to time. If an earthquake hits while we're on site, we temporarily pause operations for safety. So far, we've only recovered 1 body. The space is very tight, and without proper machinery, it's hard to operate effectively. Retrieving the body today was particularly difficult. We had to rely on both machinery and manual effort to extract it.
The World Health Organization has classified the Myanmar earthquake as a top-level emergency and is seeking $8 million to save lives and prevent disease outbreaks. The International Federation of Red Cross and Red Crescent Societies have started an emergency appeal for $115 million to help the victims. The Chinese government has also provisioned 100 million yuan, or about $14 million in emergency humanitarian aid to Myanmar. The situation on the ground remains dire. The earthquake has disrupted power supply and water systems, and high temperatures are exacerbating the problem. Healthcare facilities are overwhelmed, with 3 hospitals reported destroyed.
We fear now that the health situation may deteriorate further. And due to the destruction of the healthcare facilities and the lack of the clean drinking water and poor sanitary conditions. And that's why we are concerned about potential outbreaks of waterborne diseases and diarrhea or cholera. But also malaria and dengue fever is something we should not forget about and is a concern for us in the current area. That's why we believe that these areas need now urgent medical support, but also be provided with shelter, clean drinking water, but also mosquito nets and other items to help people who have lost everything and who are now currently living on the streets.
Despite the challenges and the 72-hour golden period has passed, rescuers are still racing against time to save as many lives as possible.
The temperature is very high, making our rescue more and more difficult. In the face of this situation, we'll not give up, and we will not abandon anyone. We're racing against the clock using the snake eye detector, radar life detector, and other detection instruments to search for and rescue every survivor.
As relief efforts continue, more rescue workers are being brought in to speed up the process. In the face of natural disasters, the spirit of international cooperation and humanitarianism shines through.